I'm Dr. James Cox with Know Your Health. So today I want to kind of go over some of the issues with the epidural and some of the issues with your changing body and kind of talk about how most people actually develop back pain. During pregnancy, you can see on this image that your posture changes significantly. As this baby is growing inside your abdomen, your spine is curved much more forward than it is on this other image where the person's spine is in line. That change in the center of gravity alters your posture and places excess stress on your lumbar spine, your discs, and all of the ligaments in your back that can cause back pain. Most people tend to gain between 25 and 40 pounds during their pregnancy, and carrying around this extra weight also contributes to stress and strain on your back. There's also hormones that are related to being pregnant that are secreted by your placenta, and one of them is called relaxin. Relaxin allows your ligaments in your pelvis to relax, and this also affects the ligaments in your spine. And the body's intention in this is to allow your pelvis to expand, allowing the baby to pass through your pelvis. Well, this also applies to the ligaments in your back, causing them to relax and to loosen, which can lead again to instability and back pain. Stress is another issue to keep in mind. As your stress level increases, your muscle tension increases, and this too can be a contributing factor to back pain. So how many people actually develop back pain during pregnancy? Well, it's estimated that occurs in 50 to 70% of all patients that are pregnant. So what are some things that you can do to prevent back pain? Well, namely, you can do exercises like walking, swimming, and riding a stationary bike. And of course, back stretching exercises that will help improve your muscle tone in both your abdomen and your back that will decrease the likelihood of you having back pain. If you do develop back pain, you can apply heat or cold packs, starting with cold, applying that 20 minutes a day to your back, and then after 2 or 3 days, switching to heat. You can also improve your posture by not slouching and sitting in line in a proper body alignment. Sleeping on your side with a pillow between your legs is another method that you can relieve stress on your back and help you reduce the incidence of back pain. Over time, there's been several studies that have looked at back pain and epidurals. And what these studies typically come back to, the conclusion is almost always that the back pain is not related to an epidural. So what the study concluded is that the overall incidence of back pain is 44% 2 months after having your baby. And the predisposing factors were a history of back pain, young age, a greater weight gain, or a greater weight starting off. So with all of those factors in mind, most of those factors are controllable by the patient. You can certainly not gain as much weight, you can increase your activity level, and you can do all of these things to reduce the incidence of your back pain. I'm Dr. James Cox with Know Your Health.